Hi, this is Dr. Singh. Today I'm doing acupuncture. I am waiting on the patient to come in. This particular day, it's a day where nobody else is around other than me and the patient. Just to let you know, you can take a good look, have an idea what the office looks like. See all that equipment we have there. We have a Sharpies. Here's the bed. A normal bed you find in a doctor's office. Some offices, they have something different than this type of bed. Here's a needle, one-time use. It sits in a package for the first time. It'll be used for this patient. You open it, and after you take out the needles, you put it then in the Sharpie. This is an infrared light. I'll probably be directing it to the area that the patient needs. It feels quite warm and it feels quite good. As I said in my previous videos, acupuncture is utilized for a number of reasons. Diabetic patients, high blood pressure, because it works. You could also select points to work with the central nervous system. And these are things that people are really not familiar with. I'm going to be showing you an example of what is done regarding acupuncture. I've already covered some things in my previous videos, but let's recap. I'll just mention just a few. Diabetes, high blood pressure, stroke patients, anxiety, stress, frozen shoulders, lower back, knee pain, neuropathy in the legs, and of course that's relatable to diabetes, and hands. So there's a little bit more, but I figured that would be, I could summarize it in that way. And the lower back pain and this area, the cervical area, is a common area that most people experience some level of pain, as we all know. This is what I would be using. This is one of the rooms, one of the examination rooms that I use. So this is what I'd be using for the area before I put the needle at the designated anatomical location. Next up, here are some needles. These needles, they come in a variety of sizes. This just happens to be the size I am going to be using. Let me see. Okay. And here are some other needles just to show you that there is a variety. What you're seeing over there in the background is the infrared light. The infrared light is used quite often, especially when you have stagnation in certain parts of your body. It helps to, I guess I would say, to speed up and improve on the treatment for that day, but it's not every time that is used. So needles, as you can tell, it has a different color top, so it's clearly indicated. Another thing that you would not know is, because you can't tell looking, this is a different size in terms of length. This is also a different size. So most acupuncture physician, I'll speak for myself, it is based on the body, the weight, where I'm going to put the needle, and what is the purpose of that particular treatment for that person. Everything is all individualized and tailored to that individual. I want to be very clear. This is one of the most uninvasive way of treating conditions and bringing the body back and unblocking certain things that could be occurring. And who doesn't have pain somewhere? Whether it's in your shoulders, and again, sometimes it's either chronic or it could be acute. My philosophy is get to it as quick as possible, so therefore the condition does not set into the patient. This is one of the primary things why I'm very, very, very alert. And I'll ask most patients, how long have you been feeling this for? Because the longer it's there, it takes more treatment and other things as well. So I believe I hear the patient. Let's take a look in the, let's take a little tour where I'm at in this particular room. Any bed you'd see in a doctor's office. Like I said, the Sharpie's over there. And we've got the blood pressure machine. We have, I'm sure you've seen one of these before. What else? And this is just basically where I'm at when I am working doing acupuncture.